President Trump says the risk of Americans getting infected with coronavirus is, quote, low. During a briefing yesterday, he downplayed the threat and potential impact in the U.S. This contradicted the Centers for Disease Control and Prevention, which has said the spread is not a matter of if, but when. Paula Reid is at the White House. Paula, what's the president's goal here?
Oh, good morning, Tom. This press conference came following days of conflicting messages from the administration about the risk of coronavirus. CBS News has learned that the president was frustrated that officials in his administration were not projecting a more positive outlook, even as the stock market tumbled. So last night, in only his second ever White House briefing room appearance, the president was trying to reassure nervous Americans.
We're very, very ready for this, for anything.
Flanked by health officials, the president said his administration has plans in place for a worst-case scenario, including stockpiling protective equipment and masks.
Every aspect of our society should be prepared.
And Mr. Trump said Vice President Mike Pence will head the task force responsible for monitoring the outbreak and coordinating with local officials across the country on their response to the virus.
I look forward, Mr. President, to serving in this role.
Health officials agreed with the president that the aggressive strategy so far had been working, but were cautious about the future.
We can expect to see more cases in the United States.
Moments later, the president contradicted that.
I don't think it's inevitable.
And there were other discrepancies on how soon a vaccine may be available.
The vaccine is coming along well, and in speaking to the doctors, we think this is something that we can develop fairly rapidly.
Although this is the fastest we have ever gone from a sequence of a virus to a trial, it still will not be any applicable to the epidemic unless we really wait about a year to a year and a half.
Health officials say prevention is crucial.
We don't have any natural immunity, we don't have a vaccine, and we don't have antivirals to treat this. So really, right now, prevention is ounce of cure.
But the administration has been criticized for cutting funding that had been dedicated to coordinating government responses to public health crises.
What he's doing is late, too late, anemic. Hopefully we can make up for the loss of time.
All right, you saw Nancy Pelosi there, Paula. We know President Trump and House Speaker Pelosi haven't been on the best terms after impeachment and the State of the Union address. Does the White House plan to work with Congress to fight the virus or get more funding?
Well, they have to if they want to get this accelerated spending package passed. Clearly, the president, the Speaker of the House, they've been exchanging these barbs. The president fired back at Speaker Pelosi there, calling her incompetent, but in the same breath insisting that they need to work on the same team. But even if the leader of the free world, the leader of the House, even if they want to exchange insults, the fact is most of this work gets done at the staff level. I've spoken with officials here at the White House, and they continue to prioritize and work with folks on the Hill to try to get a spending bill passed. Now, the administration believes that $2.5 billion spending bill that they put forward, they believe that is sufficient. They see it as a snapshot of the immediate priorities to respond to coronavirus. At this point, the White House is not willing to entertain the $8.5 billion suggestion that Senator Chuck Schumer has put forward. So at this point, they're working together. They clearly have not come to a deal, but it's easy for the President of the United States, the Speaker of the House. They can trash talk all they want, while behind the scenes, their staffs are working together. I'm told here at the White House, they recognize that there's a lot of partisan bickering. It makes things harder, but they continue to seek out Democrats who they can work with in good faith to get this done.
Yeah, it seems like with the stakes so high, collaboration would be critical at this point. Now, as you mentioned in your piece, there were several contradictions between the president and health officials. In an interview Tuesday, White House National Economic Council Director Larry Kudlow said the U.S. has pretty close to airtight containment of the virus. Do we know why the Trump administration's response to the virus hasn't been consistent?
That's right. Well, he came out and he said that he was in many ways trying to reassure the markets. He's an economic advisor to the president. But I pressed some other officials here in the White House on how that he could say that, while at the same time other White House officials, or other administration officials, I should say, from the CDC came out and said that it was likely that the virus would spread here. And they said that, look, they believe that the measures that they took early on to restrict travel, some other precautions that they took, they believe that actually worked for containment, to contain contain the virus to 14 people for a period of time, but before Congress left for their brief recess to about yesterday when this 15th person was revealed. Now, this number does not take into consideration all the people on the Diamond Princess, the dozens of people who contracted it. But the administration believes that in terms of containment, they were successful. But again, they made no mention of this 15th person at yesterday's press conference. So it remains to be seen how this will play out. I mean, if they come out this confident, insist that their measures are working and they don't work, it could be hard to regain that trust.
Now, I want to shift the focus over to the vice president and his new role. What more do we know about Vice President Pence's role in this new task force? And are there other administration officials who will also join?
Well, so much of the response really happens at a local level. And as a former governor, the vice president is going to be coordinating with state and local officials on the response to coronavirus. So he is going to oversee this. There were some reports that the administration could appoint a czar. But yesterday, the president said he's not going to do that. The vice president will report to him on this. Some of the other officials will also report to the president. But he's going to be the one overseeing this, really working on the day-to-day with the local folks on the ground who would be responsible if this outbreak continues to spread.
We'll certainly be watching that. Paula, thank you very much.